Hi, this is Dr. Gans again, and welcome to part 2 of the 5 steps in selecting a cosmetic dentist. Now, once again, just for repetition, my name is Cary Gans, and I'm a prosthodontist in Garden City, New York. There's my phone number in case you need more information. And if you would like a report on how to avoid the pitfalls of selecting a cosmetic dentist, please go to our website. I'll leave that up for a minute. And there's a button at the top of the website that just allows you to request that form. Just give us your email and we'll be happy to send it your way. No commitment, because once again, most of you that are looking at this video do not live on or in or near Garden City, New York. If you do, certainly you're welcome to give us a call. We'd love to see you, but for the most part, this is an informational video to try to help you when it comes to selecting a cosmetic dentist, because this is a major decision in your life. Cosmetic dentistry is expensive, time-consuming, and the results can be absolutely wonderful or they can be absolutely devastating. I've seen it go both ways. So that it's important that if you're going to make a decision to finally take care of your mouth, put it back in the shape it needs to be in, take a look at as yourself in the mirror and be proud of your smile, and you're going to invest this time and money, you need to be sure of who you're going to see. So in this video, and once again, we keep these down to 4 or 5 minutes, so that you can absorb it, and then when you're ready, go look for the second one. We're going to talk about what are your wants and needs. Now, what do you really want, and have you given some thought to that? Now, once again, in the last video I said that many of the patients that we see in our office just don't want to wear dentures. So we've got to figure out how we're going to keep them out of a denture forever. And I will tell you that for the most part, one of the nice parts about being a prosthodontist or about being in the cosmetic dentistry field is that if you really want to stay out of a denture, we can help you do that. It's rare that we can. Thank God for dental implants, because with the advent of osseointegration, which we've now been doing for over 25 years, with the advent of osseo-integrated implants, we can pretty much guarantee you that if you want to stay out of a denture, if you're willing to go through the procedures and the treatments that we suggest, that most dentists who are doing this kind of dentistry can keep you out of a denture. So that's a lot of what we see. The second thing we see a lot of are patients who really just want to make their smile better. They want to be able to look in a mirror and smile and be proud of it. Now, very often their child's wedding is coming up, or on some other occasion, or they took a look at a picture from 20 years ago and realized how great they looked 20 years ago, and over time things have changed. Sometimes it's just the fact that for once their kids are out of college on their own, the mortgage is paid for, and now finally they can take care of themselves. Now, in this crazy economic time, this is a major decision, and I understand that. And it's important that when you make this decision, you do it for the right reason. So, as I said in the first video, what you have to do is sit down and figure out, what do you want? What is it that you're looking to accomplish? So that when you sit down with whatever dentist or dentist that you interview, and by the way, the process should be you interviewing the dentist, not necessarily the dentist interviewing you. You have to have the questions to ask, and you have to have your wants and needs listed and succinct so they can try to help you. Now, I'll also tell you that very often dentists interview patients. Now, we look at patients and say, is this the kind of patient that we feel we can treat? Is this the kind of patient that truly wants their mouth taken care of? Is this the kind of patient that can really go ahead and cooperate enough and participate in their treatment so we can get the result we know we can do? So that interview sort of goes both ways, but for the most part, you've got to feel comfortable first. Because as I said in the first video, the customer and the patient is king. I mean, without you guys, we don't survive. And I think you have to understand that. Now, once you understand that, you have to also realize that without us, you don't survive either. So it's a very mutual kind of arrangement. So what kind of treatment do you want? Are you looking for porcelain laminate veneers? Are you looking for some kind of implant restoration? Are you looking to go ahead and just pretty up a couple of teeth? Or do you have some old fillings that just look now look a little ratty and you want to have them fixed? Or what is it that you're looking to accomplish? And what kind of treatment are you looking for? Now, certain people will walk into my practice and say, no, Dr. Gans, I won't have implants. I've heard they fail. My friends have had horrible experiences. That's a mindset that we have to deal with. So sometimes what you're thinking may be wrong. This World Wide Web that you're now listening to is a wonderful instrument. It gives you tremendous information in a very short period of time. And unfortunately, most people believe everything they see on the web. And I've got to tell you that most of it, or a lot of it may not be true. So you have to be a little bit careful, and you're going to have to place your trust somewhere. So this decision that you're going to make is very important. So please listen to all 5 parts of this and download our free report at www.gansdental.com before you make any decision about to whom you place your trust. Now, do the dentists you're interviewing have the skills necessary to take care of your needs? No, not every dentist does this. I mean, there are a lot of great dentists out there who can provide the kind of service you want, but not every dentist is skilled in cosmetics. Not every dentist is skilled in implant dentistry, and you've got to ascertain that before you can move forward. And it's more than just looking, as you'll see in, I think it's video 4 or 5, it's more than just their credentials. It's more than just what they tell you. And truthfully, it's more than just how you were referred. And that's also going to be discussed, I think, in the next video. So you have to determine, does the dentist that you're going to see, to the best of your ability anyway, have the skills you need? And there are certain tricks that we're going to try to give you in some future videos. So please stay tuned and go and listen to those videos. They'll help you along when in order for you to make this decision. And what kind of patient are you? Now, that's real important. Now, all of this cannot just be on the shoulders of the dentist and dental staff. If you know that you're a terrible dental patient, you've got to be honest with yourself. If you're not someone who doesn't keep appointments, if you're someone, for whatever reason, doesn't make you a bad person, but you've got to be realistic. If you're someone who's very anxious and very nervous and is going to require more care, more time, more listening, a little more laying on of hands, be honest with the dentist that you're going to. It will impact the kind of care that you get. You'll also find out that some dentists are very willing to do that. Some dentists are trained to handle more complicated dental patients' needs. Now, as a prosthodontist, that's something we tend to see more often than not. Most of our patients are referred by other dentists or by patients who have gone through complex dentistry. Very often we do see patients who have special needs. And that doesn't mean that you're a bad patient. It just means you have special needs that need to be attended to. So you've got to be honest with yourself. And when you look at who you are, realize whether you're someone who keeps appointments, whether you're someone who could sit and keep their mouth open for several hours at a time, or whether you need shorter appointments. Because that's something the dentist will need to know before he can make a decision as to the proper course of treatment for you. So anyway, we're finished with what are your wants and needs. This is the end of video 2. I hope it's given you some information. Please review it, think about it, and go on to video 3, which we'll have for you in a matter of moments. It'll be up online, and you can start thinking about part 3. Now, we're going to keep that a bit of a secret for you, but please stay tuned and look at it. And if you have any questions, once again, there's our phone number, and you can go and get our free report at our website. And we look forward to seeing you at part 3. Have a great day.